The majority of our patients will be seen by physical therapy on the day of their surgery. Total joint replacements and spine surgeries are slated for 7 o'clock, 9 o'clock, 11 o'clock a.m., and it's easy for us as physical therapists to see you the afternoon of your surgery. It's very beneficial to get you up soon after your surgery and help you wake up from the anesthesia. Sometimes it's just sitting you up on the edge of the bed or helping you to the bathroom, but the majority of our patients will walk in the hallway on the day of their surgery. So as your physical therapist, we're going to see you the afternoon of your surgery. We're going to come in and do our physical therapy evaluation. We're going to try to get the best mental picture of what we call your prior level of function. We're going to ask you a lot of different questions about how much activity you were doing before surgery, who lives with you at home, what kind of home you live in. Is it a 1-story, 2-story? Do you have a walk-in shower? Do you have a tub that you have to get into? A lot of these different pieces of information will help us to tailor your physical therapy treatment exactly for you. We're going to set goals for you, daily goals that need to be achieved before you get to discharge home. Some of these goals are getting in and out of the bed by yourself, getting out of a chair by yourself. Sometimes it's just as simple as being able to do the exercises that we show you by yourself. We're going to provide you with an exercise booklet that has all of the exercises in it and makes it very easy for you to follow in the hospital and when you get home. So let's talk about some of the activities that you'll be doing with physical therapy. The first one is walking. We also call it gait training. You're going to do a lot of walking because it's a total body exercise. It works your new joint. It works your core muscles, it works your back muscles. It also works your heart and lungs. Very important exercise to do after a surgery. We're also going to talk to you about and work with you on different types of transfers. Getting in and out of the bed can sometimes be difficult, especially after back or hip surgery. Getting in and out of chairs is sometimes the most difficult transfer that people can try to do. You're putting 3 times the force of your body weight on your hips and knees when you're getting out of a chair. That's why it's important to use chairs that have armrest so that you can use your upper body to help your lower body when you're getting out of that chair. Another thing that you'll be practicing with your physical therapist are those exercises. We've already mentioned them a little bit earlier. We're going to focus on the muscles around your knees and around your hips because this will help to speed your recovery after joint replacement. If you have stairs in your home, we want you to let your therapist know. It's very important that we practice those the day after surgery to prepare you for discharge. There's also a couple different types of equipment that we may issue to you while you're in the hospital. We like our patients to use rolling walkers after a hip or a knee replacement or spine surgery. It helps you to maintain balance so that you can worry about proper posture and make sure that you're flexing your knee and flexing your hip and walking heel to toe and walking correctly and trying to get out of those bad habits that you've had before surgery. If you already have a walker, please bring it to the hospital so that we can look at it and make sure that it's the right size and right type for you. If you don't have one, we will issue you one, and that way you can take it home whenever you discharge. Another thing that we may issue to you during your hospital stay is called a bedside commode. Most of your toilets at home are called standard toilets. They're very hard to get on and off of, especially after a joint replacement or a spine surgery. This bedside commode will adjust and add height to your toilet at home to make that sit-to-stand transfer a lot easier. It also has armrest on it, which also aids in the sit-to-stand transfer. If you already have one of these at home, please leave it at home. We don't need any used toilet seats running around the hospital. This will also double as a shower chair. If you have a walk-in shower at home, it's a nice place to sit to rest while you're showering.